Welcome back to Made to Be Whole. Stay tuned for our discussion on what it means to be whole and how to bridge the divide between mental and physical health.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
This is Krista. I wanted to talk a little more today about the whole premise of this podcast, which is we're made to be whole, and wholeness is a state of complete mental, spiritual, and physical well-being. You cannot divide us into our physical selves, our mental selves, our spiritual selves. It's all together and we can't separate it. I found this amazing editorial from the journal JCPP Advances. I think the JCPP stands for Journal of Child and Pediatric Psychiatry. But there's an amazing editorial that was just published in March of this year called The Imaginary Divide Between Mental and then in quotes, Physical Health, Dismantling Dualism and Reductionism to Address a Monumental Mistake in Medicine. So I saw this on social media and went and found the article because I thought it was just a fantastic premise. Interestingly, I don't know if this is just a coincidence. Most of the authors are not from the United States, but there are a few. It's not a very American thing to do. We have really done a disservice in medicine by saying, here's all your medical problems and here's all your mental problems, as if you could divide the two. And I think one of the other things that is a really, really big problem is even the people who don't divide the two only go one direction. They say, well, mental health absolutely can make your physical health worse, but physical health can also make your mental health worse by biological mechanisms, not just these like psychic belief type patterns. And we have to look at the interplay. So they talk in this article about the origin and perpetuation of the divide and this concept that modern medicine has created this superficial idea that the mind and body are separate, and that's entrenched not just in medical practice, but in medical education. It says this view has become entrenched, costly, and an impediment to progress. And regarding education, they say medical education and training generally operate in silos so that physicians with clinical care and training seldom integrate psychiatry with other areas of medicine. I think it's interesting. I was watching one of my little crime, murder, mystery things the other day, and you had someone come in with these fictitious memories. And, the first thing they do, of course, is to call a psychiatrist in for a mental health eval, which is fascinating. And I definitely think you want to work out, does this person have false beliefs? Are they a risk to themselves or others? But if somebody was high functioning before, what changed? Why aren't we saying, let's do a complete lab workup? Let's get an MRI of the brain. What happened that this person's mental status has changed dramatically versus, can we give them an antipsychotic? The concept of operating in silos. So if you think of what a silo is in farming, you've got your grain silo, and your silos are just these separate towers where different specialties operate. So we've got cardiology here, we've got neurology here, we've got rheumatology here, and and certainly psychiatry is like off the property. It's not even on the farm with everything else. And they don't talk to each other. They don't acknowledge very well the interplay between their systems, and people seem to, with all of these specialties we have, hyper focus on their specialty or their body system and will prescribe treatments and recommendations that might, for example, improve heart outcomes, but maybe at the expense of some really significant side effects, safety issues, just like so many downstream things that if we were honest about everything it could affect, it might not be the best path forward for that person. One example would be a category of blood pressure medications called beta blockers. Now, beta blockers do some fantastic things. So this is like propranolol, metoprolol. So they are really good for AFib because they don't just affect your blood pressure, but they slow down your heart and they regulate your heart to help it beat more regularly. It's does some really good things for some of our POTS patients, the postural orthostatic tachycardia syndrome. For some people with anxiety, which to me, if propranolol works for your anxiety, there's something physiological going on. But at the right doses, the right medicine can make a big, big difference. But beta blockers also, because they slow you down, can slow things down too much. They can make people feel exhausted. They can make them feel fatigued or off balance. They can increase the risk of falls for an elderly person. So it's not a case of good versus bad medicine. It's what are the risks versus the benefit of action versus a different action versus inaction. Is it really that big of a deal to get someone who is 85 down to a blood pressure of 120/80 if it means using medications that increase their fall risk? And then we know once you're over 80, if you fall and fracture a hip, you have a 50% chance of dying within the year. And long-term disability is much more common. We're not looking at how all of these things interact. So one of the reasons that I think mental and physical health are separated is because mental health is very, very difficult for people to explain. We don't have slam dunk imaging or tests that can say, this person's quote unquote depressed because this level was this. You just don't have that. And it takes a lot more work because you have to say, okay, if they're having these symptoms, what are all the different things that could cause it, including looking at, are we making them sicker with the medication they're taking? Because that happens a lot, especially in psychiatry. It's easier to just send someone to a psychiatrist and a counselor. If they don't get better, blame them for not taking their medication right or taking enough of it. It's just so easy to make it about that person and their failures versus, maybe they're not compliant with this medication because it makes them twitch and it increases their anxiety and they've gained 20 pounds that we keep yelling them about. I mean, let's dig a little deeper. And I will say too, if you look at the data for SSRIs, it's not really great. Like statistically speaking, there are some people that it helps, but it's a pretty small percentage when you look at the broad data, and it is not superior to some of the other alternatives we have for most people. So it's kind of a shortcut way to do it. And there's a lot of advantage to providers, prescribers, pharmacies to driving this drug-based model as far as getting repeat customers for life. And we have a system that doesn't incentivize deep dives. I am completely sympathetic to the fact that if you're operating within the insurance system, in order to be able to keep your doors open, you're limited to those 10, 15-minute appointments because of reimbursement rates of your insurance company. And so people are just trying to survive. And I think what is important at a certain point is I can want to change the system and say the system's broken, and that can be my passion. But I think I first have to say, I need to change myself and get me and my family better. And then I can look to some of those systematic things. And I pay a heck of a lot every year for health insurance that does very little for me. And I pay a lot of money for other things. But right now, I'm not putting my energy toward that battle. I'm getting my energy toward getting well. And then changing from the inside and hoping that patients also learn at a certain point. I've said it before, but relying on your insurance company, your provider, some government agency or hospital for your healing is just really unwise, because no matter how good they are, they're an institution and you're an individual, and there's nobody who knows more about you than you. And you've got to take some accountability, not be a victim of your circumstance, and focus on what you can. And if you don't like the model of mental health that's being shoved down your throat or your kids, there are other places to look. There are root causes that are physiological. A lot of our foundations labs can be really great for this. Absolutely, the nutrient test is, I think should be the starting place for most things, because sometimes there's really low hanging fruit. And if we find out, oh my gosh, all of their B vitamins are just garbage, we've got to address that. Another thing that I think is just absolutely amazing, I've said it before, I keep singing its praises, is our DNA testing, because it helps us understand. So I had one patient recently who did DNA testing, a teenager who had problems with OCD, anxiety, self-harm, a lot of other different things. One of the things that was most relevant in her DNA testing is a mutation that affects clotting and makes this individual prone to lower cerebral blood flow. So what that means is, because the body tends to overclot, it really impacts blood flow to the brain. When you don't have good blood flow to your brain, and thus good oxygen to your brain, delivering nutrients and other things to your brain, you're much, much more prone to brain symptoms. Now, for some people, that might be fatigue, heaviness, difficulty concentrating. For some people, it might be depression or anxiety. There's no amount of cognitive behavioral therapy in the world that is going to significantly improve cerebral blood flow to help offset that. That has to be through increased physical activity, through targeted supplements. Like, that's a very concrete thing to do. Now, does everybody need to exercise? Of course, but it's important for this person to know. For you, it's an even bigger deal. Sitting for a long time, really, really bad for your mental health, because that blood flow is slowing down more. You need to take bull by the horns. There's no medication that's traditionally given for anxiety or depression, like our Paxil, Prozac, Zoloft, that is going to help that part of the illness, because they don't increase cerebral blood flow. They're doing something completely different. But what I find fascinating is when we go through the genetic testing for the mental health piece of it, your genes are very much a part of your physiological being, and they affect the development of your personality. When you read these results and you read like, no, this is just a genetic pattern, but this can cause this person to ruminate more or fixate more on feelings, or they struggle with concentration, XYZ, you realize, oh, all these things I was saying were just my personality or a weakness or a strength that I or my child or someone else I had is actually kind of how we're programmed. And we're all programmed a little differently. Some of those things are not necessarily liabilities. We just have to be cognizant of them and adapt and stop labeling ourselves as diseases, but instead of individuals with different ways of working, and try to accommodate that we think, react, and feel a little differently. So going back to this article, it said, in many cases, mental and other medical conditions are systemic in nature and not isolated to one organ. Comorbidity, including between mental and other medical conditions, is the rule rather than the exception. So we'll go back to the clotting issue. If somebody has poor cerebral blood flow because of a genetic variant, they've got poor blood flow other places too, and vice versa. I will frequently tell people, if they've got poor circulation in their legs, they've got cardiac symptoms, but then they also have brain fog. We talk about how, okay, we've got evidence that circulation is an issue. That's not just going to affect these other parts. Maybe you get more cold hands and feet, or you have numbness or tingling or swelling. If you've got poor blood flow there, you've got poor blood flow to the brain as well, and we need to offset that. So all disease share common biopsychosocial risk factors, and they've found that if you look at pathophysiological pathways, so that means kind of disease-causing pathways, inflammation, mitochondrial and metabolic dysfunction, hypothalamic pituitary adrenal axis dysfunction, which is a lot of different hormone regulation, and changes in the gut microbiome can manifest differently among individuals and across diagnoses, but you can have the same cause. So what they're saying is you could have one person with mitochondrial dysfunction and inflammation and HPA axis changes, who their main things are like anxiety and restlessness and pain, and somebody else could have that and they have a lot of gut symptoms and depression and fatigue. And so understanding that you can have some similar root causes that show themselves differently. think about it in terms of people you know, especially if you have children. Think about your children. You can have a stressful event happen in the family and you have your kids all react a little differently. One of them might get more clingy. One of them might run away and hide. One of them might complain to their friends. It was the same event, so you can't say, no, I don't think it was really the stress of this trauma or this accident or this death because so-and-so's dealing with it fine. They're dealing with it differently. And that's what our bodies do too. They're programmed a little differently, partly by our beliefs, culture, expectations, but partly just because of our genes. Now, we talked about how there's not really an integrated approach for diagnosis and treatment of mental health stuff. One reason might be, how do we recognize and label people? So there was a study they cited of 1,146 people with major depression in 15 countries. 45 to 95%, so depending on the study, reported bodily symptoms only, headache, constipation, weakness, or back pain, while 11% denied having any of the psychological symptoms of depression, even when directly questioned, until they did these structured diagnostic interviews. I always think about when I went to a psychiatrist, probably like 25-ish years ago, because of what I called anxiety. And I look back, it was anxiety. I know now what was driving it, but I had insomnia. My brain wouldn't shut off. I had racing thoughts. And he just kept telling me, no, I think you're depressed. I think you're depressed. I think you need to take this antidepressant. And I was thinking, well, I don't feel depressed. I don't feel sad, but he was the expert and he told me I was depressed and that this was the treatment and my depression was just manifesting itself that way. So it's a label that's really easy to throw on. And unfortunately for patients, once a diagnosis gets added to your chart, that follows you around. And hopefully you have a discerning provider who's not just going to look at a diagnosis list and make assumptions about you, but that happens. I had a patient we talked to last week who had some very rare, dramatic things happen. Mom is obviously desperate, going lots of places looking for help. It's now part of their permanent record that it was Munchausen's. And that's not a very kind thing to follow someone around. In reality, it was not Munchausen's. It was some very rare diseases that people didn't know about and weren't screening about. And were they dramatic? Well, probably, because people are a little dramatic when they're desperate and when their child's at risk, but that doesn't mean that their physical problems are not real. Now, going the other way, mental to physical, physical to mental. So integrative stuff doesn't just help our mental health symptoms, but also our physical symptoms. So there was a study they did with the VA, and they did MRIs and they tracked people to say, in the next 3 years, do they develop back pain? So they said MRIs, they realized, did not predict the 3-year incidence of back pain, but depression did. Then, quote, further, only 1 in 10 biological treatments with back pain are efficacious, while psychological treatment via pain reprocessing therapy has demonstrated significant pain improvement, with functional MRI correlates of reduced responses to evoked back pain in the anterior mid-cingulate and the anterior prefrontal cortex. So what that means was the things they are giving pill-wise biological treatments, they are not very effective for back pain, but we actually have better evidence that pain reprocessing therapy, so teaching people how to reframe their pain experience and make psychological adjustments, improved their quality of life more. Does that mean their pain was in their head? No, it doesn't mean their pain was in their head, because functional MRI, which they cited here, that means you're not just taking a still shot, you're watching changes in the brain as something happens. So they did functional MRIs while they were evoking pain, they were causing back pain, and their brains responded differently after they did this training. So we are really not doing people a favor with chronic pain by only offering mechanical and biological interventions. Like, yes, there are good pain medications, sometimes surgery, we do all these other things, but we have to treat the nervous system too. We have to treat the brain. We have to teach people how to understand and relate differently to their pain. They also mentioned the fact, which I think is really, really interesting, is that because we underinvest in mental health, that trickles down to the physical health of those individuals as well. So meaning once somebody gets this label, they're part of the mental health system. It is very, very common for their physical symptoms to be disregarded. So even though increased mortality, meaning increased death rates from cancer from people with mental disorders is well known. So statistically, we know people with mental health problems actually have worse outcomes than cancer, but we aren't even screening people with mental health disorders at cancer for the same rate we are at people without mental health disorders. So trying to untangle my tongue. Okay, we know from data that if somebody has a major mental health problem, they're not going to fare as well as with cancer. So you would think that maybe what we should be doing is working harder on prevention and screening them more aggressively so that we catch things early and improve outcomes. But actually the opposite happens because their mental health disorder becomes their identity within the system. They do not get the appropriate screenings, and so you have even lower rates of diagnosis and early intervention. So integrated healthcare policy should focus on prevention, early identification, and managing everything that's going on with the person. Concomitant disease management will lower costs, even if all people care about is money. It will lower costs if we say, hey, we've got to work as a team to take care of the whole body and the whole person. We can't minimize people's pain and suffering because they have mental health problems, because first of all, you're a jerk if you do that. Second of all, some of their mental health problems may be the result of mistreatment within the system or an actual result of something physiological that's going on because, oh, gee, this thing that was driving mitochondrial dysfunction and inflammation was actually driving their anxiety. And once it's fixed, the anxiety is gone without the traditional interventions that we would use for that. So one of the suggestions that they talk about, which I think is really important, is regardless of what specialty somebody has, healthcare professionals either need to be cross-trained to do a broader amount of care, kind of the integrative approach that I find really important, or at least to increase collaboration and communication between specialties. So even if I'm a provider who specializes in one thing, for example, a cardiologist may not know as much about neurology and the impact the nervous system can have on cardiac function. So I find a partner who I can collaborate with and refer to when there's someone where I think there's a lot of overlap in the symptoms, instead of just telling someone, oh, the test came back fine, your heart's fine, it's just your anxiety, come back in a year and we'll redo the same tests. So we've got to not just put mental health on the forefront, but almost take mental out of our lexicon and just talk about health, talk about whole person health or unified health instead of putting our bodies into silos. So high quality research, this is quoting from the article, that is focused on the overlap between mental and other medical conditions is urgently needed to move this space forward. This must focus on disparities in care, predictors of adverse health outcomes, and those with mental disorders, and interventions that can close the gap between mental and other health outcomes. I would strongly, strongly recommend that if you're in a position, especially as a caregiver, where you have a family member who is not getting everything they need from the mental health system, because I really doubt there is anyone who is, to not be afraid to kind of take the bull by the horns and forge your own path forward in figuring out root cause. If they're not getting better doing the typical things, you have to look at atypical things, and then you have to find creative ways to implement them. We've had a few barriers with this. Our son, who was adopted from foster care, had to move to a group home last year for safety reasons. And anyone who thinks the government can solve all their problems ought to try having a few more government agencies involved in their daily life, because our experience over the past 6 years with Job and Family Services, the Board of DD, Children and Family Services, Probate Court, I think there are well-meaning individuals but very, very broken systems. our son was doing really, really well, other than the 1% of the time that was enough of a safety issue that he needed to be housed somewhere different. And the things that had made the most difference for him were getting him off some of the psychiatric meds he was on, and then relying heavily on nutrient and DNA testing to have this combination of supplements and medications that have really, I think, dramatically improved his baseline. Much calmer, better able to focus, mood is better, all of that sort of thing. So the problem whenever we go to institutional living, which is not my favorite thing, but sometimes it's necessary. And honestly, I have to keep telling myself too, okay, the system sucks, but it's better than it was 200 years ago. I trying to remind myself. And even though I keep hitting barriers with getting him what he needs, I have to keep looking for solutions, because in some ways it would be easier to say, forget it, we're just bringing him home and taking care of everything. It's not the best thing for him. It's not an option. I could throw a fit and say, these people have got to learn how to get in line and deal with things. I know we're an inconvenience as an involved family. I know that for a lot of these agencies, as much as they talk about wanting families to be involved, it's a lot easier for them if you're not, and they just do it their way without being watched. But what happened is, for the first several months he was there, every 2 weeks, I'd fill all the pill boxes, I'd send them over, he would give it to himself at a certain time. And then they did a self-assessment that said, no, he's not capable of doing it himself. It needs to be in the pre-filled pill packs and labeled, or individual bottles. I thought, I'm not sending all these bottles because I know staff isn't going to deal with that. I worry about it getting done correctly. So the business invested in some individual pill packs that I was super proud of, that you can put them in times of day. They're sealed, they pop out. There was a typed list of the things that had been prescribed to him and which ones were in each time of day. And we had the same thing for supplements. Then I get something back that says we can't accept that because you have to have the name of each individual supplement or medication typed on the back of each little thing that pops out, because the staff has to be able to identify each individual pill. And I mean, I get pretty angry about this stuff and tell my husband he has to deal with it. And I realized, and you might do this too, I'm not so much responding to this poor messenger who's telling me what she's being told policy. I'm responding to 6 years of bad things that have happened. And all of that is what I feel when I get kickback over just stupid stuff. That's what's coming out. So I have to kind of step back, have Eric do the communication, because I don't want to be unkind to people who are just trying to do their job, but don't have very good problem solving and have policies that tie their hands, and had to say, okay, what's the next solution? Obviously, there are pharmacies that are able to do what they need for his prescriptions, and I found a way to invest in a system that will allow you to do pill packs for supplements and have printed labels on the back that have exactly what those requirements are. I'm not giving up on my son getting the interventions that he needs, but I am not choosing to fight the battle with a broken system, because my first priority has to be him and getting him what he needs. But then there can always be a silver lining, because I thought to myself, hey, if this is something I'm dealing with, I know other people are. I know anytime there's institutional living, there are policies which are created to protect people, but which create some barriers. We could help with that. And I also thought about, wait a minute, what about my patients who have so much brain fog or cognitive dysfunction, executive dysfunction, that they're not going to get well if they don't take things regularly, but they don't have the cognitive ability to track and order and organize things, and they don't maybe have an involved family member who can do that for them. Because I spend a lot of hours every month filling pill boxes for about half my family. The other half does theirs themselves. And I thought, what would have happened if they didn't have me? So in the coming months, I don't have a date, because we want to make sure we have the staff and the setup to do that right. That's a service that we can provide for our patients. If you get supplements through us, we can't legally package supplements that didn't come from us, because we don't know the supply chain. but supplements that are packaged for us to have as an option and available service, that we will do that for people monthly, where we say, here's all your supplements. Here's the time of day you have to take them. And so every opportunity that comes to us is often disguised as a challenge or a roadblock. I'm not able to change the policies of the board of DD or group homes or all of these other things. I know that everything Owen's taking has been recommended based on labs and genetics, and he needs it. But me getting into a yelling match with someone about that, it's not going to change anything. And I would be taking it out on people who actually don't have the power to change that. And I know enough from our years in the system that what people get evaluated on and rewarded for and punished for are policies. It's all about checking boxes. That's not their fault. So I'm going to take this. I found a way to help my kid. And the silver lining is, hopefully, it will help some of you as well. Look for ways in your own life to find solutions that help you. And then don't think Facebook big when you're looking to kind of share the light and help others. Just look to those in your immediate circle. Could this help someone else in my family? Could this help a friend? Could this help people I work with? You don't have to change legislation. You don't have to go big. You literally need to start in your own life, in your own home, in your own community, and share light and solutions and help people to not give up. So I'm going to share a quote today, because we talk a lot about science and what is science. And really, science is the search of truth. That is my definition of science. I think that pure science and pure religion have identical aims. It's to uncover truth. But I found this quote from Isaac Asimov, and he says, "Science does not purvey absolute truth. Science is a mechanism. It's a way of trying to improve your knowledge of nature. It is a system for testing your thoughts against the universe and seeing whether they match. And this works not just for the ordinary aspects of science, but for all of life." So you are trying through science to improve your knowledge of nature. Nature includes you and how your body responds to things. It includes your child and what's going on with their mental health. And you are trying to harvest information and tools and anything else you can to understand better why you or this kid or this patient or friend or spouse is responding the way they do. And you're testing interventions, you're finding what works, and then you keep looking. You keep the things that help, and then you move on. And sometimes it's just maddening. I have one family member who has never had anxiety before and has had really sudden, severe anxiety, insomnia, things that have not been an issue with neurological symptoms, and it does not match. And I've been really, really grateful, because it's really hard as a family member, but then especially if you're the family member and the provider, feeling like you should have answers. And we keep trying. We're not going to stop trying, but this is taking longer than we like. And I was really grateful, because I apologized and said, "I'm so sorry. I feel such this weight because I want to heal you." And he said, "But it's not your job to heal me. It's God's job." Sometimes there's something we're learning through the trials we go through. We have to keep trying, but we don't give up. Just because the answer doesn't come right away, there might be something else. And maybe it's just coincidence all this stuff happened the way it did with my son and his pills, but maybe all of these super annoying things that make me want to rip my hair out are actually heaven's way of kind of opening a door for us to help other people in unique ways. What we're trying to specialize in is doing well for people things they can't get other places. So that's part of how, from a business perspective, I'm sorting out which services to keep and which not to. So our full-time phlebotomist found a better opportunity for her employment-wise. We decided, okay, filling that spot, we need to have phlebotomy, which is the blood draw. But what is it that we do that nobody else really does? Well, really the unique thing about what we do is being able to draw these specialty kits for people and to have good self-pay prices for labs. And so we're going to limit our hours so that we can make meet those needs and serve those people. But people who have insurance, it's not any harder for me to give them a requisition and point literally across the parking lot to one of the hospital's labs and say, hey, you can go right over there and they'll take care of it. They're set up to do it right, to process your insurance correctly, all those sorts of things. Let's shed the things that someone else can do well and focus on what can I do for someone that's unique. And you might need to do that in your parenting or your life as you're looking at like the responsibilities that you have, everything you need to do. What is it that you uniquely need to do? With my own family, because I work full time and because of my health and my family's health, I do not cook like I used to. Some of my kids would probably say I don't cook at all. That kind of depends on the week. But I've had to kind of say, okay, I am capable of cooking. I am capable of cleaning. I have really limited resources right now, and there's other things I'm doing that have to take precedence. And so if that means we eat out more, or thankfully my son Daniel, half the time he cooks for us, which has been a huge blessing. If that means that my house isn't quite what I'd like it to be cleanliness wise, maybe at some point I'll be in a position to hire someone to help that. That's okay, because there's other things I'm doing that I can't hire someone else to do. I have to focus on the things that matter most for our family, for my business, for our health, and learn what else to let go of and stop judging myself by some unrealistic expectation. I don't know why it's taking me years to let go of the fact that I will not provide the same level of culinary and housekeeping care that I did when I was home full time. I mean, that should be kind of a no-brainer, but it's taken me a while to make peace with that. And there might be some things you need to make peace with that will help your mental health as well. Letting go of expectations that just don't fit this time and season. There's a time and a season for everything. Focus on the things that matter most. Recognize you're a whole person. You are not a mind and a body that exists separately. They're one integrated whole. Your mind and your spirit, your body are what make up your soul. And if you look at yourself as a whole, if you look at your family and others as a whole, that's going to help guide your decisions and help you to find the hope and healing that you need. So remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.